Meeting is called to order, and will the clerk please call the roll?
Carter. Cowart. Esri.
Here.
Harper. Harrison.
Here.
Hartkey.
Here.
Jay. Kibler. Maxwell. McGuire. Michaels. Mitchell. Quisenberry. Rosales.
Here.
Schrader. Schwartz. Shore.
Here.
Weibel. Alex. Anderson. Berkson. Petrie.
Here. A quorum is present. This evening, Mr. Maxwell is reading the prayer.
Thank you, Patsy. When Patsy asked me to offer the prayer for this evening's meeting, it occurred to me that today, February 19th, it would have been my father's 100th birthday. My father was a quiet and patient man. So in his memory and to help guide us this evening, I will read a Cherokee Indian prayer. O Great Spirit, help me always to speak the truth quietly, to listen with an open mind when others speak, and to remember the peace that may be found in silence. Amen.
Thank you, Mr. Maxwell. Pledge of allegiance, please.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Would the clerk please read the notice of the meeting?
Notice is hereby given that a regular meeting of the County Board, Champaign County, Illinois, will convene on February 19th, 2015 at 6:30 p.m. in the Lyle Shields Meeting Room, Brookins Administrative Center, 1776 East Washington Street, Urbana, Illinois, in said county for the purpose of allowing and ordering payments of claims against the county, receiving and acting upon reports of committees and such other matters as may be brought before said meeting, which said meeting shall continue in session from day to day until the completion of said business.
Thank you very much. I do want it noted that this evening I am pulling from the agenda the item 13B4, which is resolution number 9157, setting rates for animal and pound services. And I'm pulling from the consent agenda item B1, ordinance 957, regulation of businesses offering entertainment and/or recreation. Now with those corrections, I will entertain, excuse me, a motion for the approval of the agenda and addendum for the evening. Thank you, Mr. Rosales. Thank you, Mr. Mitchell, for the second. Are there any other corrections? Yes, Mr.
Ms. Petrie, if
Quisenberry.
you could clarify the item from the consent agenda, are you merely pulling it from the consent agenda to be considered, or pulling it from the agenda completely?
I am pulling both items from both agendas
Okay.
completely.
That was just ambiguous to me, so. I wanted to
All right,
ask.
thank you for asking for that clarification. Any other corrections or clarifications needed? All those in favor of approval of the agenda, please signify by saying aye. Aye. Those opposed, nay. All right, thank you very much. Let me read through for the public. You can read your own copy of the packet, but for the public record, the following meetings that are coming up in the next month. The county facility meeting is going to be held on the 3rd of March at 6:30 here in the Lyle Shields Meeting Room. The Environmental and Land Use Committee will be meeting on the 5th of March, which is a Thursday, at 6:30, again in this room. And Highway and Transportation Committee will be meeting on Friday, 6th of March at 9 a.m., and that committee meets in the Highway Building. The Committee of the Whole will be meeting on 10 March, which is a Tuesday, here in the Lyle Shields Room. And the County Board will be meeting on the 24th of February, and that's a special, no, February. Okay. 24th of February, which is next Tuesday, which is a special study session for the presentation by our consultants on the Sheriff's Operation Master Plan presentation. That starts at 6 o'clock, not 6:30, and it will be here in the Lyle Shields room. And then March 19th will be the regular county board meeting, and that again is at 6:30 here in the Lyle Shields room. And then in March, on the 24th, we have another study session, and that is for the county board strategic planning, and that meeting is at 6, not 6:30. All right, I will accept a motion for approval of the consent agenda. Mr. Esri, thank you very much. A second, please. Ms. Bergson seconded that motion. Are there any other items want to be pulled from the consent agenda? All right, everybody in favor of? Oh, that's right, roll call. Thank you. Whispering in my ear. Clerk, would you call the roll? Thank you.
Carter. Coert. Esri.
Yes.
Harper.
Yes.
Harrison.
Yes.
Hartke.
Yes.
Jay. Maxwell. McGuire. Michaels. Mitchell. Quisenberry.
Yes.
Rosales. Schrader. Schwartz. Shore. Weibel. Anderson. Bergson. Petrie.
Yes.
Point of order, I'd like clarification on Mr. Carter's vote, whether it was a yay or an abstention.
If Mr. Maxwell will please turn Mr. Carter's microphone on, I think then we can hear it. What was your vote, Mr. Carter?
Yes.
All right, thank you very much. All right, public participation. Right now, I have 3 slips. Are there any more that have not been turned in? All right, just a reminder of our rules here at the county board is that we have an hour for public participation total, and each individual gets a maximum of 5 minutes for their presentation. And I've been asked to begin this evening with Elderess Melinda Carr. If she would please step forward to the chairs and be certain the microphone is turned on so that she is then on the public record. Is your microphone on? I can't tell. Thank you.
Good evening. I'm speaking on behalf of a coalition which members are standing behind me. I'm going to read a statement that we all voted on and agreed to, and then I'll read, hopefully I have enough time to read who the coalition members are. We are a coalition of concerned Champaign County residents working to demilitarize our local police. Since Ferguson, the public has become aware of the trend toward police militarization, especially how it impacts the African-American community. The federal government's 1033 program, providing police with excess military equipment, has been exposed in the media. Through this program, M16 assault rifles have been given to our local police, and most alarmingly, a mine-resistant, ambush-protected MRAP vehicle has been acquired by the Champaign County Sheriff's Office. We have several recommendations. We urge elected officials to instruct our law enforcement agencies to withdraw from the 1033 program. We call on Sheriff Dan Wash to decommission the MRAP. We are concerned about the lack of accountability in past acquisitions of military equipment and weapons. We ask that in the future, there be a process of public consultation before local law enforcement acquires this military equipment. We ask that police develop clear policies for how these items will be used before being acquired. We insist that such weapons are not used against minors, especially in schools, peaceful protesters, and in serving routine warrants of arrests. And the list of coalition members include Anti-War, Anti-Racism Effort, Black Student Association, North End Men's Breakfast Club, Central Illinois Chapter of Progressive Democrats, Central Illinois Jobs with Justice, Champaign County Chapter of NAACP, Champaign County ACLU, Champaign County Libertarian Party, Champaign County Young Democrats, Champaign County Citizens for Peace and Justice, Champaign-Urbana Immigration Forum, Channing Murray Foundation, GEO Solidarity Committee, First Mennonite Church of Champaign-Urbana, Ministerial Alliance of Champaign-Urbana and Vicinity, Missions, Mercy, and Justice Team at New Covenant Fellowship, Muslim American Society, School for Designing a Society, Social Action Committee of the Unitary Universalist Church of Urbana-Champaign, Students for Justice in Palestine, UIUC Chapter of Amnesty International, University YMCA, and Urbana-Champaign Friends Committee. Thank you for the opportunity to read this statement.
Thank you, Elderess Carr. The next speaker, Mr. Cruz, you just sat down. Do you want to speak? Durrell, do you want to speak?
Yes.
Oh, all right.
Thank you, and good evening, County Board. Informally known as the 1033 program, the Pentagon provides local law enforcement surplus military equipment originally intended for use by the U.S. Armed Forces without even obtaining approval from the local governing body. This program has received attention nationwide. Recently in New Jersey, Senate Bill 2364 flips this process around. It bans local law enforcement agencies from obtaining this equipment without first getting approval from the local government. It passed the Senate by a vote of 30-0 and the Assembly by 70-0 vote, which now is on the governor's desk. This raises a very fundamental question. Should the people of Champaign County have some knowledge of and input into how they want to be policed? Of course. It was troubling to learn that the sheriff acted unilaterally to acquire surplus military equipment without public prior transparency, accountability, or input. I acknowledge Sheriff Walsh's right to make decisions, but on such a potentially volatile public issue, his decision to acquire a mine-resistant armored protected vehicle reflects poor civic judgment. It is as if the board or the public's opinion doesn't matter. Consider the following. Did the sheriff inform the board or even ask the board's opinion prior to applying to the 1033 program? Did the sheriff inform the board or the community of what surplus military equipment he was seeking and why it was necessary before he made the request? Did the sheriff have a use of force policy in place prior to receiving this military equipment that clearly delineated how and for what policing activities it was to be used for? Search and rescue or pulling snow plows out of snowbanks are not adequate answers. When local law enforcement start arming themselves with free surplus military equipment designed and meant for war zones, such as M16s and mine-resistant armor-protected vehicles, even if it is painted white and a gun turret reboot, it can change the very nature of local policing in the eyes of the public. This is not a partisan issue. Both parties at all levels of government are discussing the increasing militarization of police. Governor Rauner has talked about the need for state reform of the criminal justice system. Urbana is studying traffic stop data. Chiefs Cobb and Conley would like to see more community services, such as a detox center. The issues of policing, criminal justice reforms, and jail expansion are all intertwined. An opportunity exists for the community board to extend this dialogue with the community and the sheriff's department. 23 organizations representing hundreds of county residents are expressing their concern regarding the 1033 program to you tonight. They encourage you to schedule a session to study in greater detail the various impacts of this program more closely. Thank you.
Thank you, Mr. Cruz. The last name that I have for this evening is Mr. Muth, unless I get some more slips.
Paul Muth, 207 West Illinois, Urbana. I just wanted to say a few things. I want to keep it short. By the way, I tricked out my knee and my back, so I'm trying not to stand up so much. So I'm very much associated with the remarks made, but I didn't stand up for that or the pledge. So if anybody noticed that, that's why I'm doing it. I'm going back to an Epsom bath real certainly. But I wanted to say something about affiliating with this program. It would be a good question to get answered as to whether there was any cognizance on your part of whether the program was a good thing or whether it was argued in any way before you. On the contrary, I don't know if you know about a program out of the MacArthur Foundation. They have a Justice Reform Director in Chicago, and they have some money. They have a program that would fund alternatives to incarceration, and the contact person is a Laurie Garduc. It's kind of a French-looking name, but she lives in Chicago with the foundation. I'm sure somebody could find out about it. There's a deadline for a grant writing, and I don't know. I was trying to contrast the fact that the sheriff's got good contacts apparently with the Pentagon, but somebody who's ready to fund some prototype programs for alternatives to incarceration like the MacArthur Foundation, have they been contacted? Does anybody know? The deadline is the end of next month, end of March, so I think it would be really appropriate. I don't know what kind of grant rising, and a volunteer organization like CPJ, I don't know if they could be expected to do this. I think this would be a good thing for some unit of the county board to do. I had some other notes, but I'll let it go at that. Thanks very much.
Thank you, Mr. Muth. Normally, we do not respond, but let me assure you, we are well aware of the grant opportunity of that foundation, and we are looking into it. The next person that I have is Sophia Lewis.
Good evening, ladies and gentlemen of the County Board. My name is Sophia Lewis. I represent the Women in the Jail Work Group, and I have passed around a page entitled Advantages to Restoring Parent-Child Physical Contact Visits Presently for People Held in the Current Jail Facilities. Indeed, this evening, I have heard people talk about the demilitarization of our policing, and that involves a preference for how we choose to be policed. But additionally, when that policing, we would like to discuss when that policing exerts itself in terms of taking someone into incarceration, what are the conditions thereof. And one of the most important things about that involves children of those who are incarcerated. There are several new county board members since previous times that we have brought this issue to the county board. And I would like to inform them, because a lot of people start off not exactly knowing that this year, as of January 10th, or actually January the 14th, was the 5th anniversary of physical contact visitations between children and their parents who are incarcerated, having been eliminated from the jails by a previous superintendent. And one of the first reason that we feel that it should be done and reinstated with the current facilities prior to any jail planning developments being completed is that it would be non-capital intensive. Our work group which has about 11 members strong, plus 4 more interested who are doing key things in the community, including one co-op owner. It can be, we've done a lot of research. We've spent a lot of hours visiting other jail facilitations that do have physical contact visitations. We have made contact with the San Francisco Children of Incarcerated Parents Partnership in San Francisco, which has developed the Bill of Rights of Children of Incarcerated Parents. And the 5th right is the right of a child to touch their parent who is incarcerated. And there are 8 rights. It's an easy search on the internet. It is non-capital intensive, or it can be, with minimal operating costs. An agency would be involved, trained volunteers would assist, and there would be the possibility of outside sources to share the funding that we know not yet of. We have met with the sheriff. One possibility through which we could possibly do a pilot is a room that is located on the bottom floor. It's a rather small room, however, and there has also been mentioned the possibility of using the nursing home facilitations or unused space in the juvenile detention facility for such contact visitations. And it would provide comparison to the video contact medium that is currently in use. Younger children require a sense of touch with their parents in order to process the bond and the connection that they have to them with nurture. And older children have need of time to communicate the events of their lives and the happenings going on in their lives to parents who are incarcerated. And it would provide a better model to transfer to future facilitations, because any future planning would be better informed because all of the needs for the logistics, the space, and the size and so forth can get worked through. And what you saw in the building facilities meeting the other week, that might look completely different by the time you have that sample up and running as full-fledged as it possibly can be, in any future plans that might change. And also it could begin the effects toward anti-recidivism, to curb recidivism in terms of both the individual and as well as generationally, because it will aid with both child custody and bonds of positive nurture remaining intact, not to mention the emotional and psychological impacts on both child and parent incarcerated.
Ms.
Thank you very
Lewis,
much.
Thank you. And the last slip I have at this moment is Stuart Levy.
Thank you. I'm Stuart Levy of 1108 Foley in Champaign. And I'd like to say something about the ongoing acquisition of military equipment by the county and by the cities. In the 1970s, I had a chance to visit Europe, and I was really shocked to see that police there were casually carrying what looked to be assault rifles on their shoulders. You know, not just in the airports, not just at places that you'd expect to be dangerous, but they were there. That wasn't normal here. Fortunately, it's not normal here now either. But a concern with acquiring equipment like this is, well, so last week at a discussion of criminalization and different approaches to what is made criminal, Ed Yanka of the state ACLU came and commented on an early 1990s move by the Clinton administration that put 100,000 more police on the streets of across the country. And this could well have been a good thing, but it, you know, as he pointed out, when the police were there, they felt they had a job to do, and their job, among other things, was to arrest people, and they arrested many more people, and the prison population increased a great deal. When we bring military equipment here on the streets, equipment that has been used on the battlefield, or that's designed for use on the battlefield, that looks like it's intended to be on a battlefield to impress people as if they are hostile enemies, you know, not people with constitutional rights, but enemies. When that equipment is on our streets, that's the way the police will look to the public when they're using it. This is why we should consider the presence of this sort of equipment to be a public issue, not only a matter of, it's not just a matter of, you know, having the police use a better grade of fuel in their vehicles, or this is a matter of how the police and how the government look to our population. So I hope the county board, will take this seriously and look at what can be done in making the decision as to whether this should happen, whether we should really be having these, whether we should be acquiring these things, whether we should take this drug really that's being offered by the federal government. Please allow the public to have a voice, and consider yourselves to have a voice in whether this is really something that we want. I mean, I don't want war to feel normal abroad, and I don't want war to feel normal at home, and I hope you do not either. Thank you.
Thank you, Mr. Levy. Are there any others who would like to speak this evening? Then I will close public participation. Thank you, everybody, for coming and expressing your views this evening. Next, we move on to communications. Mr. Jay.
I would like to inform the board that Gary and I invited the chair out to Mahomet so she could see what the real world's like and get out of the Champaign-Urbana stuff. And it turned out to be a cold day, but it turned out to be a very, very nice, friendly, I think a well worthwhile effort. We actually ended up sitting in a circle kind of like we are and talking about several issues. And I think it was very good that our county board chair felt comfortable enough, first of all, to come to the country. But secondly, I would encourage any of the rest of you that might have an opportunity to introduce her to the real part of Champaign County to do so. And thank you for coming.
Well, thank you for the invitation, and you might know the urban planner put the chairs in a circle, right? A friendship circle. Mr. Maxwell, did you have some comments you wanted to share?
Yes, the engineer was a little uncomfortable in that format, but he got used to it as well. All right. I do want to talk about the upcoming study session that we're going to have on the master planning report of the consulting group, Gorski, Reestack, Kimmy. It's coming up next Tuesday evening at 6 o'clock. We'll have a presentation by the consultant, and that will probably take an hour to hour and a half, based on the amount of time it took in the facility committee meeting. And at that time, the board will interact with the consulting group and ask the questions that they may have at that time. There'll be a 10-minute recess, and then upon roll call, we'll go back into session, and at that time, the public will have the opportunity for an hour to interact with the consultants, to ask questions, and ask a follow-up question, and we'll adjourn from there. Trying to make this as transparent as I possibly can, trying to offer the public the opportunity to meet with us and to give us their ideas. And I expect that we'll be continuing this process through the month of March and into at least April. So hopefully there'll be plenty of opportunity for folks to come, talk to us, and interact. The next step in the process is to go to what we call the programming schematic phase, and that was all part of the plan. This phase will take 4 or 5, maybe be completed by the end of the year, and 4 or 5 months, I meant to say, be completed by the end of the year. And at that point in time, we'll have sufficient information and drawings to better inform the public as to what the plan is, ultimate plan looks like, and also more specific cost analysis. That will be enough to go to the public in the future and explain the proposal to the citizens of this county. At that point in time, I don't expect that we'll go any further with the project until we can identify the proper and appropriate funding stream to pay for it. There are many factors that come into play. We have no idea what the governor's proposal to reduce prison enrollment will be. It could be better, it could help us, or it could make it worse for us, depending on what he actually plans to do and whether or not some of the laws and sentencing guidelines are changed. This process isn't going to move so fast that we can't accommodate many of these questions and changes that may come about as Governor Rauner's efforts. I think in the process I'm going to feel a little bit like Governor Rauner because I have to bring some bad news to people. But I think that's part of my job. And that's part of leadership. So going forward, I hope to get the support of this board and to be able to inform the public, and so that we can all come to an educated and open decision as the ultimate outcome of this study. Thank you.
Thank you, Mr. Maxwell, and thank you very much for arranging a time during the study session next Tuesday when the public can have some question interaction with the consultants and everybody who is sitting out there. I hope that you will come back again on Tuesday and bring your questions and clarifications to that meeting. Mr. Quisenberry.
I was wondering, Ms. Petrie, if you're going to share your communication with the PAC before we move on, because if you weren't intending to, I would like to do so.
By all means, please do that.
So I received a copy of a communication that our chair has sent to the.
For the audience, why don't you explain what the PAC is?
I'll get to that, to the,
Okay.
the Public Access Committee, which is a group that looks at Open Meetings Act issues and provides advisement on it, specifically on the question, what Patsy is asking about is the use of resolution and ordinance. We use both things, but she's asking for a clarification on what circumstances each one of those should be used. Is that correct, Patsy? And the other question she has is questioning whether our use of the consent agenda for items that are of substance is appropriate. Both she and Jeff Kibler went through a training in which an advisor at that training, the instructor, said that we should not be using consent agenda for substantive issues. I myself would disagree with that. The law, the Open Meetings Act, talks about our opportunity to do so. It is not, I don't believe it's completely clear on what things should or should not be on the consent agenda, but Patsy feels otherwise, so she has involved the PAC in this question, which is appropriate to do when there's a question about it. What that could mean is that the things that we consider in finance and policy and justice in the committee of the whole, the only things that go in consent agenda from that are things that are passed unanimously. So when we've all sat around the table and said this should move on unanimously, those things go on the consent agenda. A lot of folks who have commented, both legal and otherwise, on consent agendas talk about non-controversial things as being appropriate for consent agenda because otherwise they gum up the works. You spend time on things that are pretty much already decided. That's why I was not in support of us pursuing this. I thought from a standpoint of the board, I had never gotten a sense that more than one or maybe two people had a concern about consent agenda. The place where I do believe Patsy has a point is when we return to individual committees for highway and for ELUC and for facilities, we greatly reduced the number of board members that saw those things as they passed through. Previously, the previous board, those were considered in a cow, just like justice, policy, and finance. So every board member actually saw those things twice. But because of interest on the board to move to a hybrid solution, we moved back to that. So there is something to be said for the fact that even in a facilities or a highway or ELUC committee meeting, a unanimous vote means 7 or 8 board members agree, which may not be enough to say that that's a non-controversial item. But I will point out again that the beauty of the consent agenda is that if there's one board member who believes it's controversial, and that's all it takes, those items can be pulled from consent. There's no barrier, there's no wall to prevent us from considering these things. Nevertheless, the PAC is bound by the responsibility to give us feedback on this, and we will have to review what they tell us based on the questions that Patsy asked.
Any questions? Yes, Mr. Carter, and your microphone. Good. Thank you.
Well, Madam Chair, I think it's be very nice if this full board would reconsider and come back. If we want to show this community that we are really serious about helping the young people and those that choose to get in trouble, that we wouldn't have almost a full vote from this board to build that jail.
I'm sorry, I didn't understand the last 2 words. To be what?
Build the jail.
Oh, thank you.
I think I was the only one, maybe one more voted against that. That's not showing good faith to me. If you're going to say one thing and try to convince somebody else that you have the heart for them, that's not showing good faith. And I'd like to see we come back and have another vote and show more support for not building the jail. Thank you.
Thank you, Mr. Carter. Yes, Ms. Harrison.
Hi, I just would like to make everyone aware of a job opportunity and workforce development opportunity here in Champaign County. On next month, the Plumbers and Pipefitters Local 149 will be opening up their apprenticeship program. So if you are know of anyone interested in applying for the apprenticeship program, please refer them to Local 149. The training department phone number is 217-359-3446. Thanks.
Thank you. Any other communications from the board? All right, I'll entertain a motion for approval of the minutes. Mr. Maxwell made the motion. Mr. Quisenberry second. Any corrections, Mr. Weibel?
Yes, I'd like to insert the statement after the first sentence, a quorum was present. Period.
Thank you, Mr. Weibel. Any other corrections? Mr. Esri?
That was after, to Mr. Weibel, that was after the first sentence on the minutes.
Yes.
After roll call, it stated that there's a quorum present. We hadn't taken,
There are many rules. Our rules, the Roberts rules, state law says we have to have a quorum present before any
Okay.
action takes place. And right now, the minutes do not indicate the quorum was present. However, we can all attest a quorum was present, therefore, that's why this should be put in the minutes.
All right, any other corrections?
Listen to me the first time.
Those in favor of the minutes as corrected, please indicate by saying aye.
Aye.
Those opposed by nay. All right, thank you very much. Mr. Gima. Scott Gima from MPA will be giving us the quarterly nursing home report.
Good evening, everyone. This is the quarterly report for the fourth quarter of 2014. Okay, we got census, financial position, cash, and actually we're going to talk about the five-star quality ratings in terms of a survey, staffing, and our quality measure scores, and then I added have a couple quick discussion about Governor Ronner's budget speech yesterday. So our you know what, Deb, this is it's not the right one.
Are there problems? Is that what you're looking for?
Yeah, this just goes through October.
Oh, can somebody help me?
Another one on the PC?
Yeah, I don't see another one on there. Is it? Hang on a second, I can.
Oh, he sent the wrong one? You know, I'm going to have people put their phones in a basket.
Okay. Okay, now I got the updated, I'm sorry, I apologize for that. I sent Deb the wrong file. Census, so we've got the census through January of this year. Or actually, I added a partial February. So our census dropped in December and January, and we're starting to rebound. And the average so far through Wednesday was 195. The actual census today was 198, with 18 Medicare and/or Medicare Advantage in the building. And during this period, over the last, I'd say from November through February, the number of referrals to the facility has been very high. We've been averaging between 40 to 45 referrals. In the month of January, we actually had over 50 referrals, but a lot of the referrals that we received were individuals who had no payer source of any sort, whether it was Medicare, Medicaid, or their own resources. So we turned those down. In addition, we had a lot of referrals who were of younger age, between 40 to 50, that were having drug and/or alcohol issues, and those aren't individuals that we like to admit to the facility when we have a lot of seniors in the building. But the number of inquiries has been high, and we seem to be picking up in terms of the number of admissions over the last few weeks. So I would say what we've seen over the last few months was just a cyclical event, and I anticipate that we would see the number of admissions increasing. Now, the census for our fiscal year, the fiscal year 2014, we averaged 202 for the 13-month period. And I put this chart up here just to show you that that has been the best census that we've had since the move into the new building. And again, we have 245 licensed beds. Because we have some residents in private rooms or on isolation, the actual available number of beds on any given day is probably closer to 225 to 227, just depending on the number of people we have on isolation. A Medicare census is starting to rebound, 16 in January, 16 so far year to date, and again today was, month to date, but today we are up to 18. Our VA, it's been pretty strong for 2014, and we are at 2 VA residents currently. Our financial position for fiscal year 2014, we're ending the year with a $500,000 profit. Cash from operations is 1.3, and I will caveat that saying on paper, we're supposed to have cash generated from operations of 1.3, but as you will see, in terms of actual cash, it's a different story. So at the end of December, the bottom line is we had $704,000 of cash at the end of December. You can see in November, we ended the month with just under $180,000 of cash. That is much too thin. And even though our cash is up in December, I can tell you that we are watching our cash on a daily basis. And for example, today our cash balance is $400,000, but we are going to be cutting checks tomorrow, roughly about $190,000. So we're going to be below $200,000. So despite the fact that I'm showing a very solid net income for the year in cash from operations, obviously the question is why we continue to have no cash in the bank. So there's two issues. The first is the number of Medicaid residents or Medicaid applications that we currently have in the building. So our Medicaid averages between 100 to 110 residents. Right now, we're about 107 or 108. Out of those, we have 40 residents that have applications being processed by the state. They represent 37% of our Medicaid residents. Our average open application is 292 days. We have 20 applications that are over 1 year old. We have 3 applications that are over 2 years old, of which one goes back to 2012. We are owed approximately $1.2 million. And our monthly cash flow loss is approximately $180,000. So if those 40 applications do not, or if any of those applications do not get approved by the end of the month, our receivables will go up by another $180,000. So we did have 19 applications processed between November and January, but those were more recent applications and probably added just over $150,000 in receivables. So again, we have a lot of cash sitting out there, and that is the primary reason, obviously, with $1.2 million owed to us, why our cash balance is low. The second issue, on a lesser scale, but is starting to become more problematic, is with the new managed care program by the state. We have not been paid by both of the managed care organizations since the start of the program, or since we saw the beginnings of our residents being enrolled in the program. So in June was the first month that we had actually 2 residents enrolled in the program. We actually were paid for those 2 residents, but since then, starting in July, we have not been paid by either of the managed care organizations, representing, as of February 1st, we have 36 residents now enrolled in the managed care program. So you have 40 Medicaid applications, plus an additional 36 in managed care that we're working on trying to get paid. So the receivables for the managed care at this point is $276,000, but it is low because we have seen the enrollment escalate in November and December. So in October, we had a handful of residents enrolled in the program. Now we have 36 residents enrolled in the program. So what I can tell you is that I've been making a lot of phone calls with our associations, with the Medicaid, with Department of Health and Human Services, or DHS, talking about the Medicaid pending issue, trying to get attention to our applications. And the problem is, anyone that does Medicaid business is having the same problem, whether you're a nursing home or a supported living facility. But I don't have any comparison information or data, but I believe that we have significant exposure, because of all the county homes, I don't think anyone has 40 applications out there, or 37% of their population. So I just had a conversation late this afternoon with Leading Age Illinois lobbyists who had spoken with the administrator of what is the Decatur Hub. So all the applications for long-term care facilities are now processed either in DuPage County or in the Decatur Hub. And so all of our applications are supposedly in the Decatur Hub, and I'm sending the list of all of our 40 applications to the administrator of the hub, and hopefully, and I'm crossing my fingers, we'll start getting some attention to our applications. But it's going to basically take diligence on our part to continue to keep putting pressure. I've got trying to get people higher up at DHS to continue to address this issue. Our associations, both on the not-for-profit and for-profit side, have almost bi-weekly meetings with the state pushing this issue. But the fact of the matter is, and I know I've repeated this to you ad nauseum, there really has not been any improvement in the application process. Now, in regards to the managed care issue, I just had a meeting today with Health Alliance, and hopefully we will start seeing some of those receivables paid. And it was a very good meeting, so I'm confident that we'll start seeing some action. But the fact of the matter is, the managed care program is very new for the state, and there are a lot of issues that we are dealing with on a daily basis, from enrollment to authorization of either Medicaid or especially Medicare services, to billing and especially getting paid. And it is taking up significant amount of our resources at the facility level and at MPA to try to get these issues resolved. But we'll continue to push forward, because obviously we have to get paid. I mean, that goes without saying. So let's talk about our quality rating. So these, and I gave this to you at the last quarterly update, and this is the most recent 5-star quality rating. And what we talked about last time is that, our current overall rating is 2 stars. And the reason why, we were actually at 4 stars as of July of last year. But as everyone knows, we had some bad surveys later on in August with our annual survey that brought our survey score down from 2 stars to 1. So what I want to talk about is some of the things that we have done since then to get ourselves moving back in the right direction so that we can get ourselves back to a 4 and hopefully to a 5-star facility. Now, the caveat is that because the survey history score is based on a rolling 3-year history or look-back period, it will take us 2 or 3 years before we'll start seeing that survey star score moving in a positive direction. And it means that we have to get better surveys moving forward. So what are we doing? The first thing is we're trying to get all of our open positions filled. And the biggest issue that we had was trying to get our nursing supervisory positions filled. And it's been something that we've been dealing with for not just months, but for years. But in November of 2014, we had 15 full-time positions open. By the end of January, it's down to 9, and most of those are with nursing management. 7 part-time positions that included activity aides, food service, and housekeeping have all been filled by the end of January. Our CNAs, approximately 28 FTEs or positions were opened at the end of November. At the end of December, we were down to 19.5 FTEs, but at the end of January, we've taken a few steps backwards and we're up to 25.9. And the reason why is that we've had some separations in January and February. We had 5 in January, 3 in February versus 1 in December and November in each month. But one of the other issues is that our staff are allowed to make a status change or to change from full-time to part-time status or vice versa. And unfortunately, at the end of the year, we had 13 CNAs decide to switch from full-time to either a 0.2 or a 0.4 part-time position. So, but what I can tell you is that since November, between November and December, we hired the equivalent of 8.5 FTEs. In January, we only had 1 CNA hired, but so far in February, we have hired 4 CNAs, and we have, I don't have numbers, but what I've been told is we have a bunch of applications that are currently being looked at. So I feel confident, even though we've taken a few steps back, we have a pipeline of applications that seems to be fairly consistent over the last few weeks, and hopefully we'll continue to get those CNA positions filled so we can reduce our agency.
While we're on this, thank you. Scott, I read a report recently, I know this is something you and I talked about when I served on the nursing home board. Are you going to move on an HR position? I read that was a possibility in a report that was emailed recently.
Yes. So one of the other positive things that we've seen in 2014 is the actual number of CNAs that have left Champaign County Nursing Home was the lowest in 2014. So those would be a combination of terminations or resignations, and we only had 41 for the year. I mean, it's the best year that we've had, again, since 2008. Contract nursing. This slide doesn't have the actual numbers, but in November and December, we were just under $100,000 each of the month. I think in November, we're at $98,000. December, we're at $99,000. In January, we're down to $77,000. And as we get more CNAs hired, we will get the contract nursing spending down. And again, we've talked about it before, but that is the goal, to get it down as low as possible. So in terms of the nursing supervisory positions that we have filled, it includes our director of nursing. We added in this year's budget a second assistant director of nursing position. So previously, all we had was a DON and 1 ADON, and the feeling was that, I mean, we're taking care of 200 residents. I mean, we're a good-sized equivalent to a good-sized hospital. We need more nursing leadership in the building, so we added and we have filled a second ADON position. For a very long time, we had supervisory positions that we could not fill. That includes Unit 2, which is our Medicare unit. That's been filled. Our day shift supervisor position, which actually was filled but turned over, and knock on wood, we were able to refill that position within a matter of weeks. Our evening shift supervisor position is now filled. And we also filled, that I missed on this chart, is our supervisor that oversees both Units 1 and Unit 3. And one of the things that we did, because we had a difficult time finding RN supervisors, is that supervisor over Unit 1 and 3 is a social services individual or with a social services background. And the thought process there was a lot of the issues that we deal with are non-clinical. And so far, it's been a very, very good hire that we had on that unit. One of the other issues on the survey was food service. And so obviously, it's been a very big issue for everyone. And these are our pinnacle scores. So again, this is an independent survey of 15 random family members every month. And you can see that the scores are not positive in general. You know, between November and December, dining went down from 3.67 to 3.33. Food quality went up. So my takeaway from this is we still have work to do. There has been improvement in our food service, but we still have problems with consistency from day to day. One day, it runs smoothly. The next day, it'll be problematic. So what changes that have we put in place? We've got a new dietary director. We added some additional food carts, which has expedited the delivery of the food from the kitchen to the dining rooms, because we do have 3 separate dining rooms or 4 separate dining rooms. We actually purchased additional plate warmers and our plating times. So our plating times is when they start putting together the first plate of food to when they end with the last plate of food. And those plating times have been more consistent on a day-to-day basis. Our staffing has improved. We need 19.5 FTEs in the kitchen. We are currently staffed with 15.2 FTEs, so we have a need of 4.3. And right now we have offers out, as of today, to 3 food service workers and/or assist cooks. So again, we do have additional applications that we're reviewing, so hopefully we can get all those positions filled over the next few weeks, assuming we keep our turnover down. So where are areas of focus to get our food service where it needs to be? First and foremost is staffing. Second is supervision. So again, we have a dietary director, we have 2 managers or supervisors, and we also have a dietitian. Consistency in getting the trays into the dining rooms and to the residents on a consistent basis. Accuracy of the trays to the meal tickets. If I wanted biscuits and gravy, I'm going to get gravy with my biscuits. And I hate to say it, but on some occasions, the gravy is missing from the biscuits. Customer service. Simple things like when you give tray to a resident, you just ask the simple questions. Do you have everything that you ordered? You would think that if you give them the plate and you open up the cover and it's supposed to be biscuits and gravy, they would have seen at some point in the process, from when it was plated to when it was delivered, that the gravy is missing. And also asking, has there been anything else or anything else that I could give you? And just being attentive to the residents while you're in the dining room. Those little things are a lot of the issues that we're trying to deliver consistently on a day-to-day basis. Quality measures. And what this points out here is that we have made consistent improvements over the last few years to get our baseline quality improvement process moving in a positive direction. We've gone from 2 stars to 5 stars currently. So what does that mean? What are the quality measures? So the quality measures that determine that rating are listed here: falls, pain, pressure ulcers, how many urinary tract infections you have, how many residents are physically restrained, and I can tell you we have 0 residents that are physically restrained. New ones are antipsychotic drug use. The federal government has really been pushing to reduce the amount of antipsychotic drugs that are being used in the building. And I can tell you, we are a 5-star facility on quality measures, but the areas that we're working on right now are falls and urinary tract infections and urinary catheters. I'm trying to get those reduced. All the others, we are well below the national averages, and that's the reason why our scores are looking so good. Staffing, and you can see here that we dropped from 4 stars to 3 stars. And the way the staffing rating works is, when we get our annual survey, we submit a payroll report to the surveyors. When we looked and saw that our staffing rating actually dropped by a star, we really literally were scratching our heads. So we went back and took a look at the data that was submitted to the surveyors, and we found out that we had 478 hours of nursing time that was not submitted. And it was as simple as we didn't copy the backside of the report. I mean, I wish I had a better excuse, but that basically was it. But we caught the problem. It's been submitted to CMS, and we will get those numbers, we'll get credit for it, and we believe that we can get the staffing rating up by a star. Now, whether it actually increases our overall star rating, we're not quite sure, but we're hoping that it does. And hopefully, either by the end of this month or next month, we'll have an answer of whether we see our staffing score increases. Any
All right.
questions?
Yes, are there any questions for Mr. Gima? Ms. Michaels?
I'll be nice. Once again, I know I've asked this before, but I'm going to ask it again. There are monies that are owed us, that are on our books, that are over 2 years behind in payment. At what point do we charge those off or consider them, in my sense of the word, bad debt? Because we can't just keep carrying that. It really makes the numbers a little off, if you will, especially since we know we probably won't collect 100% of that as time goes on.
With those Medicaid pendings, it's my belief and opinion, again, I know it's only my opinion, those are good receivables. There's no reason why we should not collect 100%. Now, I can tell you, it may be tough because some of the issues that we're dealing with these applications, not a lot, a handful have been denied because the state has said that the families did not submit a financial document in a timely fashion. And then they tell us you can reapply, but we're not going to go back to the original date of admission. Now, I have a fundamental problem with that because they're taking over a year, or almost a year on average, to review an application, and then they're going to deny payment to the recipient, or especially to us.
Yeah, yes, Ms. Michaels, you have a follow-up?
I might not be understanding this correctly. Well, then, do you make an adjustment on the receivable if they are not accepting the application from the date that it was originally done? Because it sounds like now there's a new start date, and we probably should not be retaining that prior original application date as part of the receivable. We should take it from where they now figure this is a valid claim and go forward?
It is possible, but again, I'm going to fight to the, but in the event that they, let's say they decide to go back 9 months instead of 12 months, yes, we will have to write that off without question.
I think Mr. Carter and then Mr. McGuire. Mr. Carter, please.
So it's have dropped since I was in there about 8 months ago. And my question is, why that we keep on, you keep telling us the board that we have all going to do a good job. Oh, we got somebody in there now gonna do us a good job. And we keep falling all the time. Now, it's worse now than it was when I was in there 8 months ago. So, we need to get some answers. We need to get some answers about the board that is running that. If I had a foreman, wasn't making me any money, I sure wouldn't keep on hanging on to him. He would have to be replaced. That just shows bankruptcy. If you keep on, if you got somebody that's not showing you a profit and keep going down the hill, there's some changes need to be made. And I've been asking this, and I keep on getting the same old story. Oh, we'll be better after a while, but when the after a while comes, we still going down.
Thank you, Mr. Carter. Mr. McGuire.
Okay, well, like Diane said, I want to be nice too, and I want to tell you I appreciate the improvement in the graphs, the work you're trying to do in hiring supervisors and the CNAs, because obviously it's having an impact on the bottom line if we're not using the agency nurses as much. The hiring that's going on in the food service, more supervision, more staff will obviously improve food service, which will improve the quality of living in the nursing home. Just try to encourage you to keep hiring and working to do those things. So I know I'm hard on you when I don't see what I think what we need to see. So I want to make sure I encourage you when there are improvements. So keep trying. I know it's going to be tough with the state, but
I'd say my first question usually when I check with the home is, what's the census? But the second question is usually, where are we in our hiring process with our CNAs and food service workers? I mean, it's I'm taking a lot of attention to it. When I'm here, it's one of the first things I do, to go back there in the kitchen, looking in the dining rooms to see where things are at. So it's not for a lack of attention. I know it's been taking way too long to get improvements, but it's not for a lack of attention to try to address the problem as much as we can.
All right. Thank you, Mr. McGuire. Other questions? Oh, yes, Ms. Cowart.
Okay, my question is, since we're having so much problem keeping staff, we need to try to figure out why we can't keep the staff. Do we do any kind of exit polling to find out what reason that they no longer want to be at our facility?
We try to do it as much as possible, but I can tell you our success rate is very poor in getting exit interviews. But we do attempt with every separation to try to get information, but the return rate is very poor. Now, one of the other things, as Mr. Harkey had said, we are looking to hire an HR director to help us with those issues, so we can retain our staff, reduce our turnover, and improve our retention rates as much as possible.
Did you have a follow-up question?
Yes, I want to find, do we offer any kind of training or anything to our staff and the head of nursing, you know, where that they can maintain some kind of rapport with the staff that we currently hires, where that they can, because this seemed to be more of a personality issue or something like that, the reason we can't keep them. And do we offer any kind of training where they can have some kind of sensitivity training?
One of the reasons why we're making the investment in additional supervision is to address those issues. Now, I also want to point out, though, that 2014 is the lowest number of CNA separations that we've ever had. I mean, we've gone down by 48% since the high of 75 in 2008. So we are doing a better job on the CNA side, but turnover in a nursing home is always an issue. So we're always striving to improve that process, and we're trying to do it by having more supervisors on board so that we have more just hands on the deck on a daily basis, working with our staff, but also talking with our existing employees, because we do have issues with our existing staff sometimes not treating our new people or welcoming them like they should. So it's all of the above. It's a complex issue. We're dealing with personalities, but we're looking at every opportunity we can to try to retain our people that we're hiring.
Thank you, Ms. Coward. Other questions? Mr. Carter, did you have another question?
Anyway, your assignment is bad.
Thank you.
The head person that's supposed to be supervising his division is bad. You have people that really don't know what they're supposed to be doing. You have them doing kitchen work, all other kind of work, and you ask them, well, who's supposed to be taking care of this down here? They can't give you an answer. That's one bad problem you have, assignments. And I think if you take care of that problem, it would kill a lot of that.
Mr. Shore, I'm sorry I didn't notice you previously.
So yeah, one thing that definitely sticks out from this report is the issues with retaining staff. And so I was wondering if there was any consideration of maybe incentivizing people to fill out their exit interview, like just like a $10 gift card or something, you know, to get the data that you need?
Hadn't thought about that. But part of the problem is, I mean, we could take a look at that, but we just can't even get them to respond to a phone call. So, but it's something I never thought about doing.
Thank you, Mr. Shore. Other questions? This is your opportunity. All right, Mr. Gima, thank you again for coming and reporting to the board. Oh, Mr. Esri.
Well, did you, Mr. Gima, mentions you wanted to maybe make a few comments on the governor's
Oh, sorry, forgot.
budget speech? I mean, whether or not you still want to.
I guess I should. No. So in the governor's budget speech, $1.5 billion in Medicaid cuts, 12% cuts for hospitals and nursing homes is what he's proposing. So that equates to roughly, at 12%, a loss of roughly $850,000 in Medicaid revenue. I think I showed for the year we had a $500,000 profit, the best year that we ever had. Obviously, a 12% rate cut would just absolutely wipe that out. Now, I've been on the phone all morning trying to get more feedback from our contacts in Springfield. So obviously, it's the first shot across the bow. We've had these issues with rate cuts before, and at the end of the day, they are substantially less. My feeling, my opinion is that we will probably see rate cuts, but it won't be anywhere near 12%. But I am assuming moving forward that we will see rate cuts. Now, because we have the intergovernmental transfer, a 12% rate cut would actually only reduce our entire Medicaid reimbursement by 7.7%. So without going into the details, the IGT does protect us to a certain extent, but we would still see a decrease. So, you know, at this point, we'll have to wait and see, but we have been working with both leading age or associations, metro counties, the County Nursing Home Association, and MPA also has a lobbyist that has been working on behalf of Champaign County, Peoria, and DeKalb County. We've been working on two issues. One, trying to preserve our Medicaid payments in the event of a Medicaid payment slowdown. Number two is trying to get help on the Medicaid applications. We're going to add number three, which is trying to protect our county nursing home Medicaid reimbursement. Now, I cannot make any guarantees of whether we will be successful at the end of the day in protecting our county homes from any rate cuts, but we are going to make a substantial effort on behalf of Champaign County and probably for all the county homes to try to preserve our reimbursement. We have a higher cost structure mandated by the regulations. We have to provide IMRF. No other private home provides retirement benefits. That's hundreds of thousands of dollars in additional expenses. It seems unfair to me for the state to penalize county homes who take care of the Medicaid when no one else wants to. They're basically trying to put county homes out of business. And that's basically the argument that we're pushing on behalf of the county homes. I think it's a very strong argument. We made it with Quinn's administration, and we got a lot of positive feedback. We were able to get our payments expedited. But we have to start from scratch with the new administration, and we'll see what happens. But we are going to make that effort on behalf of Champaign County to try to protect ourselves from any rate cuts.
Mr. Esri, do you have a follow-up? Anybody else? Well, I have a question based on your answer to Mr. Esri's question, which was very important. When you ran that calculation of a loss of over $800,000, did you run a calculation to figure out at what percentage point we could tolerate and what percentage point that would really be dissipating to the nursing home? You say with the transfers, it's like 7+%. Can we take 2%? Can we take 3%? What would it be?
I can't say at this point, but I'd say, if we had roughly a 2 to 5% rate cut, we could easily handle that. Anything over that, we'd really have to take a look at any additional expense control. But at this point, what we're looking at is filling our beds, maintaining a good payer mix, which means Medicare. We have to have more Medicare. If we can get more Medicare in the building, we can handle a rate cut. Because increasing our Medicare census by 1 on an annual basis, by 1 resident, adds over $200,000 in revenue. And it's a very minor incremental increase in expenses. So that's the name of the game, but that's the game that every nursing home is playing to get more Medicare. But all the strategies, all the efforts that we've done over the last 3+ years is to set us up for this managed care program to work better with the hospitals so we get more Medicare. And so again, with the numbers that you're seeing with occupancy in 2014, it shows that we've been successful in positioning ourselves in the market to get more referrals from our primary customers, the hospitals, and now it's the health plans.
Mr. Quisenberry.
So just to clarify, that dollar amount that you gave us for 12%, was that backing into the 7.7 you said that it would translate to because of the reimbursement or the intergovernmental
It's an actual calculation based on if we reduce our Medicaid rate by 12%, it actually increases the IGT contribution so that that it reduces the effective reduction from 12% to 7.7%.
Okay.
So we would go from, instead of losing $850,000, it would be more on the order of $500,000 or so. Still a big
Okay.
number,
Which
but
essentially wipes out any profit we had this year.
yes.
And, I really appreciate your pause before responding to Patsy's question, because I think you should have inserted the caveat, if things remain the same. If we have another year like we had this year, this is what we could tolerate. Well, we've seen, over the last several years, our census vary widely, not necessarily associated with how good we're doing as a nursing home. We have a year where there's a flu that gets out of control and more people die from it, our census goes down. So that any answer to what we could tolerate has to come with all other variables remaining equal, which is pay mix, census for the year. So, maybe it's 3% if things stay equal. Maybe, if we have a census problem, it's not, it's 0%, right? So that's just one variable that we have to worry about.
Any others questions that have been stimulated by this last conversation? All right, Mr. Gema, thank you very much again.
Thank you, everybody.
All right, moving on the agenda to standing committees. I know that Mr. Maxwell provided a report related to the county facilities. Do you have any further comments on that report? And then would you please move that it be put on file? All right, please. Oh, you said you have no more, or you do have some?
I have no further comments on the report.
Okay, thank you very much. Mr. Esri, do you have any comments related to environment and land use?
No items for action before the board tonight.
All right, thank you very much. And highway, Ms. Cowart.
There's nothing from the Highway Committee for board action.
Thank you. All right, moving on to Justice and Social Services. Would you please move the resolution, Ms. Bergson?
Adoption of resolution number 9139, approving contract renewal with Community Elements for the reentry programming for Champaign County.
Thank you, Ms. Bergson. Is there a second? Ms. Cowart, thank you very much for the second. Is there any discussion on this motion? All right, all those in favor of the motion, please signify by saying aye. Aye. Those opposed by nay? Nay. All right, thank you. The motion passes. Finance, Ms. Michaels.
I'd like to move adoption of resolution number 9140, authorizing payment of claims authorization for February 2015.
Thank you, Ms. Michaels. A second from Mr. Quisenberry. Do you have any questions on this resolution? All right, all of those in favor of the motion, please signify by saying aye.
Aye.
Those opposed, nay. Thank you. Please continue.
The next, I move adoption of resolution number 9141, authorizing purchases not following the purchasing policy for February 2015.
Thank you, Ms. Michaels. Is there a second? Mr. J., thank you very much for the second. Any questions on this? All right, all those in favor of the motion, please signify by saying aye.
Aye.
Those opposed, nay. All right, Ms. Michaels.
And third, I move adoption resolution number 9142, authorizing the cancellation of the appropriate certificate of purchase on mobile home permanent parcel 30-058-0225.
Thank you for the motion. Is there a second, please? Mr. Esri, thank you for the second. Any questions or discussion on this motion? All those in favor, please signify by saying aye.
Aye.
Those opposed, nay. All right, the last item, Ms. Michaels.
The last item was removed, ma'am.
Oh, that's right.
Thank you.
Nothing like not paying attention to what I did at the top of the agenda. Mr. Quisenberry.
Yes, I move that we ask the Job Content Evaluation Committee review and evaluate the Highway Department's highway accountant and highway projects accounting assistant positions.
Thank you for that motion. Is there a second, please? Mr. Anderson. Yes, Mr. Quisenberry.
Yeah, just to fill everyone in, this was a thing that we would normally do in the policy cow, but the request came in too late to make it on our agenda for the policy cow, so we're doing it here at the full board.
Do you have any questions for Mr. Quisenberry? All right. Yes, Mr. Harper.
Is this because somebody's retiring and it's just time to check it out?
Mr. Blue is here if we
No,
want
that's
to
fine.
ask detailed questions.
I think that's
But
what I
there's a
understood.
memo in your packet regarding the reason.
All right, any other questions? All right, all of those in favor of the motion, please signify by saying aye.
Aye.
Those opposed, nay. All right, thank you very much. Do you want to carry on with the addendum?
I sure will. I'd like to move that we appoint Sam Shore to the Environmental and Land Use Committee.
Thank you for the motion, Mr. Quisenberry, and a second, Mr. Esri. Any questions or discussion? All those in favor of Mr. Shore being appointed to ELUC, please signify by saying aye. Aye. Those opposed? Now you can vote, Mr. Shore.
I should be more clear. I move we approve the chair's appointment of Jack Anderson to the Workforce Development Board.
That's all right. Is there, thank you for the motion. Is there a second? Ms. Michaels? Any discussion or questions on this? All right, all of those in favor of the motion signify by saying aye. Aye. Those opposed, nay. All right, your last item.
And finally, I move that we approve the chair's appointment of Pius Weibel to the Regional Planning Commission Board.
Yeah, is there a second? Do you want to second your own nomination, Mr. Weibel?
No, I want to make a point of information, though. Mr. Quisenberry, actually.
Wait, I don't know who did the second. Ms. Bergson? Oh, Ms. Coward. All right, thank you very much. Go ahead, Mr. Weibel.
Actually, these appointments are board appointments because the chair, once the chair presents appointments to the board at a committee level, they belong to the board, so they no longer are chair appointments. Just a clarification there. That's Robert's rules.
All right, anything else? All those in favor of this appointment signify by saying aye. Aye. Those opposed? All right, thank you very much. Any other business that you would like to bring up? Mr. Esri?
I'll do a quick update. Had a meeting on the Mahama Aquifer on Tuesday afternoon. Basically, there's not been a whole lot going on since September of last year. I will just mention real quick, the sole source is basically still kind of in limbo, I guess you could say, at the US EPA. They haven't ruled on it one way or the other. But it'll be coming up like towards the end of this month, the beginning of next month. The coalition asking for some more money, and the reasoning for this is the Clinton landfill has not yet asked for a siting hearing with the DeWitt County Board, but it's suspected that at some point in time they will. And then they will have their people there to present their side of the story to the DeWitt County Board. Well, the idea is that we need to have people, the coalition needs to have people to present our side of the story. So that means hiring an engineering firm and attorney, or lawyers, attorney firm. They aren't using the same attorneys that they've used before, in part because there was some conflict of interest, so they had to kind of find, of having worked with engineering firms, they had to find some firms and lawyers, engineering firms and lawyers that could work together because of conflicts of interest. And just if everything comes together the way they're hoping, these are the rough numbers. The grand totals that they're looking at for both the fee, the total fee would be roughly $171,000 at the low end to $262 at the high, with the county's share at the low end of about $17,000 and at the high end of about $26,000. Now that could be brought down some in part because they are going to approach Rantoul. Right now, Rantouls is in the counties. There's no guarantee if Rantoul as a city will come in, but if they do, that will decrease the county's share of this by that percentage based on population. But we'd have the whole list here. There sounds, I guess, pretty promising that this list will come through, but it includes Illinois American Water, Bloomington, Decatur, Champaign County, Normal, Brand. There's a whole list of them. So, and it sounded pretty positive that they would all come in on this, but no guarantees. So a little bit of a heads up.
Are there any questions for Mr. Esri on his report? Yes, Ms. Michael.
I just have a quick question. At one point, didn't we put some money away for this, or was that something else that got moved around?
Ms. Busey, please add some information.
We have appropriated funds for 2 different contracts for the Muhammad Aquifer, and they have both been underspent. So as soon as we get additional confirmation, there may be, we'll have to re-encumber what has not been spent, and whether or not we have to add to it remains to be seen.
All right, any other questions for Mr. Esri? Thank you for the report. Any new business? All right, I entertain a motion to adjourn. Mr. McGuire, is there a second? Mr. Quisenberry, all in favor? Aye. You just got warm.